first category of codes are office visits. These codes are determined by whether the patient is new or established. Please pay close attention to the code description. New patient codes require that all three key components are met in order to assign the code. However, established patient codes only require two of the three key components. Hospital coding is reported on a day-to-day basis, or hospital inpatient services. And these are divided into the episode of care. The initial hospital care is the care for the day of admission. These codes are used only once per admission, and it includes all the services that the admitting physician provides during the admission, such as writing orders, ordering labs, etc. Initial hospital care codes can only be reported by the admitting physician. Subsequent visits are reported once a day, and they are the visits after the day of admission. And hospital discharge services are used on the day of discharge only. These codes are based on time spent by the provider preparing orders, writing prescriptions, speaking to family members, etc. Observation status codes are for when a patient is too sick to be home, but is still not determined whether the patient is sick enough to be formally admitted into a healthcare facility. Consultations. Consultations are services that are requested by a physician for another physician to render their opinion. Please note that a second opinion requested by the patient or the family member of a patient is not considered a consultation. Consultation codes are divided on whether the patient is outpatient or inpatient, and consultation codes can only be reported once by the consulting physician. Emergency department visits are within code range 99281 and 99285, and these services must be performed in an emergency department of a hospital-based facility, and they must be available 24/7. Critical care is care that needs immediate medical attention. The patient requires a constant attention by a provider. Now, the patient does not necessarily need to be in ICU in order to be receiving critical care. And critical care codes are time-based, and documentation must support the critical care codes that are being used. Please be sure to read all the guidelines for critical care. Neonatal and pediatric critical care services are inpatient services where the patient is critically ill. Please be careful. The textbook has not been updated and the CPT codes have been changed. The new range of codes is 99468 to 99476. Neonates are from age 0 days to 28 days of age, and pediatric age is from day 29 to 5 years of age. This too has been changed in the new CPT and has not been changed in the textbook, so please be careful. Continuing intensive care services are used to report services where the patient no longer falls under critical care guidelines, but require intensive care. These codes are usually determined by the weight of the infant. Nursing facility services are inpatient services. These codes are determined on whether the patient is new or established. Domiciliary, rest home, or custodial care services are also known as boarding houses. These services are considered outpatient services. They can be assisted living, but there is no medical supervision. You must know whether the patient is new or established. Home services are for services provided at the patient's private residence. They are also determined by whether the patient is new or established, and the provider must document why the patient was seen at home. Prolonged services are add-on codes. These codes must be used with the basic EM code, and they are used when the basic EM EM code time has been exceeded by at least 30 minutes. If it is less than 30 minutes, you cannot report a prolonged service code. Care plan oversight codes are reported on a monthly basis. These codes include all the care rendered to a patient over a 30-day period. Patients that are in skilled nursing facilities or under the care of a home health agency cannot be assigned a care plan oversight service code. Preventive medicine are for annual physical examinations and are based on whether the patient is new or established and on the age of the patient. Please pay close attention to the age of the patient. Now, the remaining EM code sets, there are several categories, but the most important thing that you must remember is that you have to read the entire code description. If you do this, you will code correctly. Please feel free to contact me with any questions.